Well, interestingly, the SCUlpTOR trial in osteoarthritis is in fact a Phase III trial, and the GVHD trial that we mentioned before was a Phase I, and we're now moving forward to Phase II in that indication. But we were able to leapfrog into a Phase III in osteoarthritis on the basis of the safety profile of our product demonstrated in the graft-versus-host disease study, and also the history of use of MSCs in arthritic conditions, particularly osteoarthritis of the knee, where many of the listeners will be familiar with autologous stem cell-based treatments, typically adipose-derived stem cell mixtures, which are derived from the patients themselves. And these studies these applications of MSCs are quite widespread, but the clinical data supporting their use is a little fragmented. So ultimately, the group that we're working with at the University of Sydney in Australia were very keen to establish one way or the other whether an MSC product is in fact effective in addressing osteoarthritis, and particularly the degenerative nature of that disease. Hence, they designed a large 440 patient clinical study, double-blind, placebo-controlled, randomized study. So a gold standard clinical study with sufficient numbers of patients to establish good statistical data to confirm whether or not these cells are effective. And obviously our hope is that, and our expectation is that the cells will in fact be effective and safe in these patients, but will address this significant unmet medical need in osteoarthritis, and that is reversing or at least halting the degenerative nature of the disease. Most treatments for osteo at the moment are simply based around symptoms, that is, relieving pain. So analgesics are the treatment of choice, ultimately leading eventually to surgery. But nothing really addresses the degenerative nature of the disease. So our hope is that we will see at least a halting of the degeneration of the joint, but potentially also reversing the damage that occurs with this chronic condition. And that data we expect will come out in the next couple of years following completion of the study.